Hello, everybody. This is Wednesday, so that means it's time for another edition of the Progress Report. And just to remind everybody that because of social distancing requirements, which I think is a mislabeling what we should be calling it, I think it should be called physical distancing. We're all doing no less social distancing as we all live on Zoom and Skype and things like that. But whatever, so we're here at the studio, and I am required to be with only one other person, and that person is my guest for tonight, who was an outstanding guest we had here a month and a half or so ago, and is Phil Alexakos from the Manchester Public Health. And it seems like a lot of things have changed here in the time since you were last here, Phil, and I think it's time to, bring people up to date on how you perceive things. It's just interesting walking here from where I parked down Lowell Street and down the part of Elm Street, and compared to what we've seen, there's a lot more activity. And Panucci's right in the corner of Lowell and Elm. The place was booming. They had somebody, a singer out on the street, tables on the street, and people seem to be wanting to be out. And not surprising, it's a beautiful day, of course. But the result is it's going to be Phil and I, and we will be expecting to hear from Mike Farley, who's planning to call in. We can't have Mike on Skype because of the way things are set up here when we're doing live shows back to back. To fit him in on Skype is apparently difficult for the director here, Brendan's, but we are expecting to hear from Mike very soon. And so we're looking forward to having an update from Phil. Last time I was here with Lou D'Alessandro, who introduced me to Phil, and I'm very glad he did, because that was a show that I think went extremely well and was very informative for people. And Manchester is fortunate to have a Department of Health, and Nashua has one, and those are the only two departments of health in the entire state. Other communities may have a local doctor who's the health officer, and that's what my father did in Goffstown many years ago, but not a real Department of Health. And given that we have so many people that come to Manchester because of the services we need and then create issues we have to deal with, we have a call. I suspect that might be my good friend Mike Farley. Let's see. Hi there. Is this Mike?
Yes, it is, Brendan. How you doing?
It's not Brendan. It's Bob.
Oh, hey, Bob. How are you?
Good. And if you're watching, I'm here with Phil.
Hi, Mike. Nice to meet you.
Hey, Bob. How are you? Good. I am watching. I have to turn the sound down because there's that delay and it confuses things. But I figured I'd give you some time to do the introduction.
Yeah, your timing is very good.
Co-opted the airwaves on you.
You weren't here when Phil was with us before because Lou D'Alessandro was, but I know you watched the show, and you
to
thought
my great disappointment, I must say.
Not on the show, but not being here. I'm sure you mean, right?
And then not being here, yes. No, yeah, I jumped in a little late there, Bob. You got to forgive us with the timing here, but we're not our old selves with our typical comedic timing. But yeah, that's what I was trying to get at. Yeah, I missed that. I wasn't at the show.
But we're glad to have you join us, Mike. And I know you probably don't want to stay the entire hour or just hanging on the phone, but. You want to lead off? You got some. You want to bring up some issues with Phil?
Well,
Phil.
I do have a few, and it's not that I don't want to. I'll tell you two things. One, I know sometimes we don't get callers, but I want to try to leave the phone open for callers, especially with this guest because it's so timely and important and so local. So I don't want to monopolize all the time because, it's a call-in show and we should get as many callers as we can. But I do have to admit that with my elbow bent like this with the phone up to my ear, after a little while, it gets a little painful for me. I'm getting old. So I will monopolize the time a little bit, and I'm hoping that my questions might, lead to further discussions between you guys after I hang up.
Sure.
But I guess... The big issue is, and I have a few other questions, but the big issue is this going to work? Can I, as a potential consumer, feel safe and want to go downtown? I'm going to be frank. I've been very frank about it. I'm not feeling like it's safe to go out yet. And all of the open restaurants on Elm Street aren't going to convince me to go down there. So I guess a general comment. What do you think about the general safety of this situation?
So I'll try to answer the question. When we talk about public health, we talk about a lot of things like risk. And so, it's sort of like a multi-legged stool. In order to determine what your risk is, you need to know a lot about what it is that you're facing. So we have been, experiencing COVID-19 in the United States, since February, March. So it's only been a few months. It seems like an eternity, really, because our crew has been working 24/7.
It really does.
Incredible hours doing a lot of the things that I'll talk about that happen behind the scenes. But we've really tried to rely on information about who is this affecting to inform our testing decisions, to inform our risk messaging, to inform, where do we go next, and sort of put that picture together. So, I think New Hampshire has taken a pretty conservative approach as it pertains to restricting activities. And nobody takes these, decisions lightly when we're talking about people's livelihoods. It's critical. And so, I will say that New Hampshire has taken a very measured approach and has been very intentional about, what is open versus not open. And it really starts with critical infrastructure. So the things that have to happen to keep the lights on, to keep the food supply in order, to make sure that we're tracking down cases of illness, to keep people at home so that they don't make others ill. These are the things that have to happen to maintain what we call continuity of operations. And because we're learning more about the disease, we're learning more about who it impacts, more so than others and more severely than others. We look at all these data points and try to make the best decisions, weighing all factors. So, the decision was made that, getting, obviously food is important, but being outside is a much less risky proposition if you're sitting with people that you are usually with, like family members or others in a small group, and you're distanced from others, because we know that the virus can persist on surfaces. And when we do investigations, we look at how long have you as a person, how long were you exposed to a person who was potentially infectious? And we use that 6-foot barrier that you hear a lot about as sort of a benchmark for what we know about droplets. So if somebody's coughing or sneezing, generally speaking, a 6-foot radius is, an infectious area that, if you spend a lot of time, more than 10 minutes with someone, and that's why Bob and I are appropriately distanced, because even though neither of us looks to be ill, I think one of the most difficult parts about this is that you can be infectious to other people up to 3 days, and this is what we know right now, up to 3 days before you even show any symptoms. So a lot of the, wear a face covering when you're out in public, people get very particular about, it's my choice to wear a face covering, I'm not sick, I get it, personal choices are personal choices, but when you are potentially impacting others and you don't know it, it's not so much of a personal choice anymore as it is a potential risk to others. And that's really that kind of scale of, public health justice, if you will, to say, you could be one cough or one sneeze that's pretty innocuous could have implications for somebody else. So putting a face cover does have an impact. So the first graduated step beyond let's keep the lights on, let's keep the food supply going, let's keep critical healthcare services going, is what can we do in an environment that's the least risky? And the outdoor environment is that kind of starting point. So that's where we're at now. We're in only sort of the next phase. And one of the things that I hope to see in the very near future is some phased guidance. Some of our neighboring states have put together, Massachusetts yesterday, and some other states have put together sort of different phases of, we'll say, relaxing some of the restrictions, if you will, in a tempered, measured state, because the way this virus behaves, if you will, is that there's about a 14-day period that the virus you could be exposed to it until you actually develop illness and become infectious. So it's a pretty long window of time between the time when we put an intervention in place and the time when we're going to see if that works. So the governor's talked a lot about sort of 2-week increments, I think, in some of his press conferences, and that's really tied to the epidemiology or the study of how this disease behaves. So doing, let's let everybody do this, could kind of let the cat out of the bag and create a surge situation that we've seen in other states that overwhelms their medical systems. Now, I will say that the things that we talked about back in, I think, March, where we were setting up, makeshift hospitals for potential surge, because we were seeing that happen in other areas, because we took some pretty critical measures early on, we did not see that level of surge. I can tell you right now that our hospital data, the hospitals have sort of phased back in some of their elective procedures and things that were put off that weren't critical. And their bed counts are getting pretty close to what, on the higher end of what their licensed bed counts are. So we have to be very mindful of several different pieces of data as we move forward in these phases. So it's I get daily reports of how many tests were done, what percentage tests were positive, what's the bed counts in all of the hospitals in the state, how many ventilators are available. So we're collecting and analyzing this data, because if we start to see a trend, and we usually use a 3-day trend or a 7-day or 14-day trend, because by the time we put a restriction in place, it may be too late to kind of pull the reins back on something. So we're looking at this stuff daily, and I mean local health departments, the state health department, which we communicate multiple times per day on a whole host of different things. But right now, we've taken that first step to look at, can we do things outside? Let's face it, there's always the balance of we want to be active, and there's the whole wellness about being out of doors and in the natural environment that is health promoting. But if you have congregation, that in and of itself lends potential transmission. So some of the things that have been selected for relaxing are because they are more distance-based, and some things are areas where we can put in protections that can protect people, like in the dental services were phased back in because the clinical environment, people are more familiar with standard precautions and bloodborne pathogens, and it just takes a bit
I was at my dentist's office today, and they did a great job.
Yep.
They checked me in properly.
Good.
I had to text them from the parking lot. And first of all, I want to back up, and I want to say two things.
Please.
I didn't mean to interrupt.
No.
First of all, best answer I have ever seen. Holy cow, we can end the show now. And second of all, that must be because it was a good question.
Yeah, there you go.
I neglected to say thank you to you and your staff. I really should have led off with that. And my bad for not doing it. You guys, I can only imagine the kind of hard work and the kind of brain work that you guys are doing, trying to do these analyses that you just talked about. And certainly for me, and on behalf of everyone that I can speak for, we're very grateful for you and for them for doing all that.
Well, I'm so fortunate to work with the most dedicated group of caring professionals. There's a lot of good people, locally across the state that are really, putting themselves, and their families kind of to the side while we really tackle this unprecedented public health, circumstance. So I want to thank you for recognizing that. And, in public health, we're not very good about talking about what we do unless there's some sort of an emergent event. But I just, I'd like the people at home to know that there are people who are looking at all of these things on their behalf on a daily basis, whether it's COVID-19, whether it was Ebola when that was, entering the country, or whether it was H1N1 or any of those things. We're working on a daily basis to prevent disease and to investigate diseases on behalf of the whole community. And this is just a very public-facing, national, international situation that's really, something that I hope is only once in a career. But it really is through the
huh?
Yeah, I hope so. It's really through the partnerships.
I agree. It's had a very interesting intersection with me. My mother was a nurse, ended up teaching at St. Anselm College, so healthcare kind of was dinner table talk for us growing up. I'm the safety officer for my company. I'm in construction, and I have spent the past week and a half writing COVID-19 safety plans so I can submit them to the general contractors we work for, so we can get our guys back to work, because Massachusetts is opening back up again.
Yep.
And my wife works in a dental office and part-time works in a grocery store. So we've had that
Wow.
component of this as well. And holy cow, it is consuming a whole big chunk of people's lives. And I've been so busy working COVID that I haven't had a chance to think, geez, I'd like to go out to a restaurant, I guess. Maybe that's why I'm not feeling like going just yet. But I certainly understand the outdoor component of it seems to be very, very important. And if you're going out to eat with, like my wife and I, we're sharing this space anyway, so the risk is the same whether we're eating here or eating at a table that's 6 feet away from anybody. So
Yeah.
maybe it is a good thing to get out and at least try to catch a meal and support a local business and help those employees get back to work.
Yeah, I mean, it's been so hard on so many people, and that's one of the things that like when I mentioned before that when you restrict people for a public health reason, so we talk about isolation and quarantine. If somebody is infected or infectious, they have to be isolated, and if they're exposed to someone, they have to be quarantined. It's sort of like dominoes of response. Whenever someone is under isolation or quarantine, their movement from their house can be severely limited. So one of the things that we needed to do as a community is we needed to set up a way for people to get resources if they're under isolation and quarantine. So we have a hotline that we have for people who need resources. So we connect folks with different funds that have been set up. We have set people up with, if they're on isolation and quarantine, we brought them thermometers because you can't find a thermometer anywhere. And if we're asking people to stay home and monitor their symptoms, we're helping people, get access to other services as needed. Because when someone can't leave their home, we have to make sure that they're able to be taken care of. So it's not just as simple as please stay home. It's what else do you need? And that's why, when we take those measures and, we're monitoring people on a daily basis, we have over 400 to 500 outbound calls on a daily basis every day of the week to people that we're monitoring at any given point to see if they're symptomatic or if they need anything. It sort of goes hand in hand. So it's a pretty complicated web of activities that the health department, the school department's done a great job with getting not only educational materials out, but think about the children that have food insecurity and making sure that they have access to meals that they would typically get at school that they aren't getting or they wouldn't get had we not thought of this as community partners. So there's so many layers, and this really affects so many people in so many different ways that it's not always just about the health ramifications. It's about other services. It's about we're just scratching the surface of what the mental health ramifications are of COVID-19. Just the fact that we're isolated in different ways, it does have impacts. And with mental behavioral health issues, it's not just a now impact, it's a ongoing what happens afterward, let alone the caregivers and our frontline medical workers and emergency medical services folks. And I want to give them a shout out. It's Emergency Medical Services Week. So we thank all of the folks that are out on the front lines responding to medical calls. But all of these people are seeing some very difficult things through all of this. And so we need to be mindful, hopefully when this is over, that we don't drop the ball on making sure that those who have been responding and people are checked in on. That's something that sometimes when the event is over, you sort of forget about, oh great, we finished that, but this has been very impactful, and we have to be mindful of that. But we want to get back to safe operations, to some semblance of normalcy, and I've spent the better half of 4 or 5 days now working with local restaurants to make sure that they have all of the elements of the plans in place for setting up their seats, and they need to ask their employees medical questions now. They never did that before, so they have to screen people, ask them questions. They have to change some of their disinfectant protocols from a safety perspective. So there's a whole host of things that we're trying to make sure are happening so that when we reintroduce things that used to occur, we do it in a way that's informed with best practices. And so, everything is different. I've been talking to the school district about end of year activities, whether it's cleaning out classrooms We're working to figure out to get belongings out or medicine out. What about graduation? So we're having meetings with the SAU and other schools about what that looks like. How do we do that safely? We still have a stay-at-home order 2.0 in effect until May 31st. And we'll see hopefully we get some guidance about what happens after May 31st. Are we going to, change some things? Are we going to let different groups get together? Are we able to do, my son he's 11, he lives, breathes, and eats baseball. He has been very despondent about not being able to do his sports. And there's only so many video games that are healthy for you to play of sports. And, I've got an email from the league saying the plan is after June 1st, so they know something that I don't know, that there's going to be the ability to bring back non-contact sports in a safer way. So it may be that all parents are going to sit in the car, and if you talk to the umpires, they're probably happy about that. I'm a soccer referee. I'd love to have the parents.
I must agree.
I'd love to have the parents hide, in the car, but basically, it's just we don't always have the luxury of time. But as we learn more about the virus and how it behaves and what things we can do to minimize risk, knowing that you're never going to have zero risk, but what can we do that's safe and informed, and things that people can do, because when there's an emergency, people want to take action. So what actions can you take? I can put a face covering on. I can make sure I use hand sanitizer. I can, if I don't feel well, don't put others at risk. And I think, and I say this to any group or anybody that I'm talking about, we have to think of things differently as a society, that things that we do, our choices do have impacts on other people. And I'm all for, personal decision making and taking, being a responsible adult. But when you don't know that you're sick and you're not taking precautions that are, what is known to be effective, then, why is that? Is it that you don't care about other people? I would hope not. It's just that I don't think people realize that they could have impacts on other people. And other people have other people who are at home that are immune compromised or taking care of their aging parents at home, and it's just that 6 degrees of separation, if you will, that could have impacts. So trying to think beyond yourself in this instance will go a long way in allowing us to open things back up. It's just making sure that people are doing things responsibly will help us get there quicker.
Yeah. Mike, can you
playing off of that, I kind of set 20 minutes into the show as my deadline for monopolizing on the phone. I hope these questions.
I'd be happy to have you stick with us, Mike. I'd be happy to have you stick around, Mike, and see if you want to chip in something else, because those are great.
Mike can call in and pretend that he's someone else if the lines are open. That might be interesting.
I do think I expect you'll probably get some other callers, but I want to play off of what you just said, which I think was very important, and essentially to give you a chance probably to say it again. What about enforcement? We're going to these extraordinary measures to try to open things up. Me with my trepidations, all right, I muster up the courage, I go downtown, I'm sitting at a table, and then right over next to me, they're 6 feet away, is a group of people who don't wear masks, and maybe there's 11 of them or 12, and what kind of enforcement? I know that, it's very difficult in my company to enforce the mask wearing. People don't want to do it.
Yep.
How can we go about making sure that component of it gets deployed? It's a weapon against this disease.
Right.
I guess I want to go back to what you said. The stay-at-home order, it worked. We didn't have this great, tremendous surge on our hospitals, but now we're releasing that. Is it fair to make it a free-for-all? Is it fair to open up all the beaches, or do all of us still need to be careful of our neighbors?
Yeah, absolutely. I think you said.
And with that, I will take my call off the air, Bob. I'm going to stick to the 20-minute rule.
All right.
We're about halfway through the show. I want to make sure that callers can call in, but I do want to leave with that. How can we all help this opening up work better?
So I think you really nailed it. If people take the precautions that have been laid out, then the time that it will take for us to say this is still working, we can, move the needle a little bit in this direction to, see. I hate to say see what happens, but we can take a gradual approach. I think by the sheer nature of being able to be outside more, kind of lessens the density of living arrangements.
Yeah.
We typically see infectious diseases in a much more impactful way during late fall through mid-spring because we are forced to be close to one another in a colder climate. So flu, norovirus, we see cyclical seasonal patterns with those. Are we going to see this sort of lessen because we're able to be out and less interactive? Maybe not. But we can't just say, okay, I've had enough of this COVID stuff, I'm not going to do anything.
Yeah.
Because then, that could be an issue.
It's occurred to me that maybe one of the fortunate things that we didn't get to the worst part of this in November when we were all going to be, at home a lot more anyhow because it was winter.
Yeah.
At least we're getting to the point where we have this partial opening, and it's a time when you do want to be out and enjoy what we have to offer here, which is plenty of beautiful places to visit and all that sort of thing. So when we were here with you last, when Lou and I were here in March, I think at that point I don't remember whether it was really. It took a while before we got the recommendation that people should wear masks.
Right.
That was something that was not early on, and now it seems like a very definite recommendation that we should all do this.
Yeah.
And so I'm kind of wondering. What have you learned as this pandemic has gone on and you've dealt with it on the front line as you have? What have you learned that you didn't know from prior epidemics?
So if I were to rewind the tape and think about what I might have said and probably should have said and hopefully said, one of the first things that I've learned in dealing with something that's novel or new is that the public and the professionals that are working in this field need to know that the guidance is always going to change. And that is very difficult. That is a difficult message to give because when you change the message, you inherently you seemingly discredit the information. Oh, they told me that I didn't need to do this last week and now they've changed their mind. They don't know anything. Well, this is an evolving situation. We had information coming out of China that was it reliable? The state controls the media there. We don't really know what was truthful or not. So we didn't know it until we could study it for ourselves. So we've learned things over time. I think the use of face coverings has evolved. And I'll just try to speak about that in general terms. So on a non-COVID day, if you encounter somebody who is, if somebody is ill, that at your doctor's office it says, if you have a sore throat, cough, or fever, you should be wearing a mask. So that's not a new message. People think that it's new, but the signs were at Dartmouth Hitchcock when I would go for whatever visit, right at the registration window, whether people just saw it enough times that they didn't see it anymore. And the reason being is when you put something over your face and it's a droplet infection like COVID, most of those droplets, or a lot of them, are going to get stopped by the covering. So the purpose of the cover is actually to protect everybody else.
Right.
Where we get confused is the N95. Everyone likes N95. I need an N95. I'm a member of the public. I need an N95. Well, an N95 is a device. And the N95, and there are about 300 plus different models and sizes and shapes, which means that there are different configurations that may or may not fit well to the person who's wearing its face. So this one, I've been fit tested. So when I put on this N95, I know that I have a tight seal and I have a protective device to protect me from everything else. If you buy one of these at X hardware store, and they do sell N95s there for lead dust, asbestos, and other things, you have to actually have a fit test. I would imagine most people haven't had a fit test. I bet Mike is well aware of fit testing. It's great to put this on, but if I don't have it properly fitted, there are holes, and it's potentially a problem. The other thing about COVID is unless you're doing a procedure on someone, it's not generating aerosol that floats in the air for long periods of time. So it's probably helpful, but it's not necessarily any better. The other problem is people were buying these and then there weren't enough for healthcare providers.
Yeah.
So the simple face covering does knock down things that you're putting out. And if somebody else is wearing one also, then it's like an extra barrier if you're within 6 feet. If I'm 6 feet from you, there really is very little risk. If you were coughing and sneezing, I probably would automatically back away from you and put on my respirator. But we learned that the messaging changes. The other thing that we learned is when we started, and I think probably another thing we probably talked about is we had no idea how long the incubation time was. And incubation time is the time that I was exposed to the virus to the time where I become sick. So that's a window of time. It could be up to 14 days, depending on how much virus you get exposed to and how vigorous your immune system is. What we don't always know is when are you infectious? And that is what is tricky, because for a lot of illnesses, you're only infectious when you have developed symptoms. With norovirus, the cruise ship bug, you can be infectious a day prior. With H1N1 back in 2009, you could be you could be infectious up to a day or so before you became sick. And that's where things get tricky. For this virus, you could be infectious 3 days.
We're pretty sure of that now. It's 3 days.
We're pretty sure. Yeah, it's that. In fact, when we look at contact investigations, so every one of the 900 plus cases that are in Manchester residents that our staff have investigated, and each of those investigations this is the case, and then anybody else related to that case, we have to call and then let them know that they've been exposed and that they need to go on a 14-day quarantine and monitor symptoms, and we check in with them because they could be incubating the virus. So each one of those people has to be called and checked in on and restricted from potentially making other people sick because of that window of time where they may be infectious. So we know that people can be infectious, and that's what makes this really difficult, that people could potentially be causing other people to get sick and not even know it. That's why, your own decisions have a lot of potential impacts on other people.
Very good. Very good. Let me turn to the issue of testing.
Yep.
Testing. I have a niece who's a nurse out in Oregon, and I said, geez, I haven't had a test. Should I get a test? She said, well, is it going to change your behavior? And I thought, probably not, because I think I'm doing the appropriate, safe things already. I'm not sure it would change my behavior. And yet I wonder, I hear so much about the number of tests. Maybe people, even though it's not going to change their behavior, is there some benefit to them having tests?
So I would say there is a benefit to having tests, and I like to frame it in this way, because we are seeing a good percentage of people that are testing positive that have reported no symptoms. It really underscores the importance of what you said, your own behaviors. So if you are working in, a critical infrastructure, healthcare, any other, energy, things that are important to sustaining daily life, and you're going to work, and maybe not everybody's wearing a mask because, we all feel great. When you start to take your foot off of those best practices, there could be people that are not symptomatic in any way. You would have no inkling. And that is when things, can go sideways, especially in, in an apartment complex where there may be shared facilities, things of that nature. So we've thought about our testing. Initially it was, let's prioritize people who have the travel history. So back in March, we opened up a testing site at the Armory. If you traveled, you were a healthcare worker, we wanted to test you because we need to get you out of work if you're sick and not have you expose other people. As testing has become more available, we've changed. We always, as a local health department, are sort of a safety net for people who don't have access to care.
Okay.
So we have kept our Armory site open, and we've been able to do, I think we've done 1,600 people since mid-March, and a lot of those folks don't have a primary medical home or have some other risk factors that they needed, expedited testing. And each one of those tests is an opportunity to make sure that somebody isn't putting others at risk if we can identify them.
Okay. I think we have a call.
Okay, great.
Hi there. Is Bob, are you with us on the line?
Hello, I'm still here.
Okay. Are you with us?
Hello.
Hi.
Hi.
Welcome to the progress report.
Bob, how are you doing?
We're doing good. Welcome. Glad to have your question or comment.
I live at the Perrisville High Rise. We have 100 apartments in this building,
Mm-hmm.
and however, people are not social distancing. They're not wearing masks. Some of them are, and some of them are not.
Mm-hmm.
And it's very risky living here because you never know who's carrying the virus and who isn't. And I try to help people out by saying you should wear your mask, if you have one. And sometimes they just don't want to listen. That's about the extent of my call.
So,
Well, thank you very much for the
Thank you.
call, and we'll give you your answer from
Yeah.
Phil.
So
Thanks for calling.
Thank you for calling. Appreciate it. So I'm glad that he called, because one of our, when we set up our testing sites, and obviously, there's some private sector testing sites, some public sector testing sites. We also have an obligation as a local health department to look at folks that either don't have access to a primary care physician or have barriers to getting to a testing site. So we have worked with MHRA, Manchester Housing and Redevelopment Authority, and we've actually been to Pariseau, O'Malley, Mary Gale Home, Reverend Burns, Governor Gallen, all of the subsidized aging housing in the city, and we have actually offered tests to everybody in those apartments over the last week. So we've done over 350 people, and we did outreach ahead of time to say this would be available on this date, and it's all free. But not everybody availed themselves of the test for whatever reason. So there's also an opportunity to do education, and certainly being mindful if your neighbors are not properly social distancing. It's good to share why that's important. And one of the other reasons why we wanted to make sure that people were aware of that is that anyone who's over the age of 60 is inherently at greater risk for poorer outcomes from COVID infection. So if we were able to identify someone who is positive, we could have a very clear interaction with them about you need to stay in your apartment, and we can get you what you need through our hotline and link you to services, but not put others at risk. That's a more sort of public health intervention. It's actually rooted in, they call it public health police powers. We don't want to be the police, but it's essentially, we're telling you need to stay home because you could put others at risk. So we wanted to find instances where people might put others at risk unknowingly in many cases. So with that, outreach is education as well. So I appreciate your call. Thank you, and please, tell your fellow building mates that it's important to take care of one another because inherently you are more susceptible, and unfortunately, if you have underlying medical conditions or you're over the age of 60, the data is very clear that you are much greater risk of being hospitalized and dying, quite frankly, from COVID infection as opposed to people of different age groups.
As time has gone on, Phil, it seems to me that there's maybe a reason to have a little growing fear, as our caller apparently does, that people are, not being as compliant with the recommendations they were. They're just getting tired of wearing masks and being at home.
Yeah.
Are you finding that to be the case? I just know that, when we were first all locked down in March, there was almost no traffic on the roads. Now I see there's a lot more traffic,
Yeah.
which isn't necessarily bad. You're pretty safe in your car, I guess.
Yeah, of course.
You haven't been, offering rides to a lot of people.
Right.
But is that a concern that we're slacking off on the communal effort to stop this virus by being very compliant with the guidelines?
Yeah, I think it's important that because we can't, it's not a flipping a switch. It's not, okay, we're all of a sudden done with all of this stuff. And I think it seems like a lot longer than a few months, I think, for everybody, for whatever reasons.
sure.
I mean, my wife's a teacher, so she is teaching her classes first grade. That's very difficult for that type of learning. But our own kids are distance learning as well. So whether it's, being at home and trying to work and managing kids and making sure they're getting their education, whether it's people in critical infrastructure who have been away from their families for countless days on end, to folks that are struggling, to pay their rent, that have lost their jobs, everybody is impacted in some way. And it's so critical that, yes, people are getting like, oh, the weather's nice and it's like a blooming flower, we're all going to just go out and do stuff. We just have to do, basic, fundamental hygiene, good practices, and keep those going, because, whether it's COVID, whether it's something else, all of the things that we're talking about are going to help us with seasonal influenza, from norovirus. None of these things are pleasant, but, hand washing and hand sanitizer is important. I know that the fire department just got a huge supply of hand sanitizer, and they're ordering containers so that if people don't have access, and I know a lot of our businesses have really struggled with getting personal protective equipment and hand sanitizer and other supplies. And, we have a good relationship with our state partners. The state has been very understanding of our needs in terms of situating a representative in our emergency operations center that we opened many months ago, so that if we have specific needs, that we can get them answered in terms of what resources we might need as a large city, that other communities might not have the urgency for. So we've been pretty fortunate in that regard to have a good ear to get supplies, but they're not unlimited.
Yeah.
And so we're trying very hard to cover this from so many different angles. And I really want to thank my city partners, especially at Manchester Fire, Manchester Police, AMR, which is our emergency medical services provider, and our hospitals have been great leaders in thinking of our community beyond their day-to-day operations. So we were able to set up a very sophisticated 230 plus bed facility in 3 days at Southern New Hampshire University, with the leadership of the hospitals, the supplies and manpower from public health and Manchester Fire, and the generosity of Southern New Hampshire University at their field house, in case we were to see what would happen in other areas of the country. So,
And I guess as it turned out, due to the fact that our population is pretty much cooperating with the one tool we got, we actually didn't need to use that facility. Is that right?
Absolutely. We did not have to do that. The hospitals, to their credit, and they have taken an inordinate financial hit.
Yes.
A lot of the revenue that they generate, they do a lot of uncompensated care, but a lot of the revenue they generate is for non-emergency procedures, and they haven't been able to do those since mid-February, and they're just phasing those back in. And I know that this was actually made. A case was made last night at the board of Mayor and Alderman meeting. That there are all these pots of money that the legislature is trying to study and figure out, in different committees and different acronyms and everything else. But our hospitals have cared for the majority of COVID patients in the state, and they have both said very publicly that they've only received a fraction of supportive funding, and it's not commensurate with the need.
Yeah.
From a public health perspective, we've been making this argument for decades that, Manchester's population is 8 or 9 or 10%, depending on the year, but we don't have 8 or 9 or 10% of the need or the burden of a condition or of a certain thing. Mm-hmm. So it really should be commensurate on what the data says. So part of me is very happy that we're looking at data and knowing that one part of the state doesn't look the same as the other. So what happens in Manchester, that's why we want to look at Manchester data and Nashua data and regional data to figure out, because we know that people live and work in different areas, that we make these kind of reopening decisions, not just a one size fits all, but there may be some instances where maybe it's not appropriate for Manchester to do something as the same as Portsmouth.
Yeah.
And because of tourism or some other reason. So we have to look at this from many different lenses, and it's all happening in real time. So I think that's the other message, is we can't let our guard down. We can do reasonable things. We shouldn't just abandon the practices that we've put into place. But it doesn't mean that we can't also move forward.
Yeah.
So we are making progress, to take part of the title of the show. But we have, it's measured progress.
Yeah. We have the governor allocating funds that you just been talking about,
Yep.
where our hospitals is, I think, have a good case that they've been under.
They've really
They've been under
done a good
resourced with
job.
those funds that are available, given the job that they've had to do, and they've certainly let us in the legislature know about that very, very clearly and loudly. And so we understand that problem. How do you? The governor has to make these critical decisions.
He does,
And he has to rely on experts. And how do you have input into the governor's decision-making process, or what's the chain by which you bring your expertise to bear to help him make the right decision?
So that's a great question. So I know that the governor has set up different sort of subject matter task forces, and there is a representative from the state public health department who is part of that process. We have a direct line of communication with the Commissioner of Health and Human Services, Lori Shibinet.
Yeah.
So our director, Anna Thomas, and I know the Nashua Public Health Director, Bobby Bagley, have at least a weekly call with the commissioner, sometimes also involving the hospitals, to talk about issues that are germane to Manchester and Nashua as two cities in a mostly rural state. So we have a direct line of communication with the commissioner, which is very helpful. We have a really strong, we've always had a strong working relationship with the Department of Public Health Services. So that would be Dr. Chan,
Yeah.
Beth Daly, Dr. Beth Daly. She just earned her doctorate in public health, so congratulations to Beth. She's a wonderful resource. Before I came over, we had a call to talk about some additional funding that is prog to come into the state to support testing and the contact tracing and the case investigation piece. So we have being in a small state, I will say, has its advantages in the sense that we have the ear of people that we need to have the ear of. So it's not like we're 17 layers down as a small local entity in a big giant ocean. When we have an issue, we can talk to the commissioner. We can talk to our colleagues at the state to coordinate. So we actually did some, just-in-time strategic planning about, what does that funding look like? What can we best use it jointly? So that's been a real bright spot in all of this, is that we do have good relationships, with all different circumstances. Sometimes we don't always have things, promptly, but it's only a phone call away. We just say, hey, give us
that's
a
good.
heads up on this, and we work together, very well.
Going back to testing again.
Yep.
Kind of hopping around here.
Sure, of course.
Bear with me.
No, please.
I got two more questions on testing, I think. One is, we hear about a lot of false positives and also false negatives, and we hear that there's some tests that are, more doubtful about giving good results than others. How are people sure that we've got the right test being administered to detect the COVID-19 properly?
So I want to make a distinction about testing. Excuse me. There's the test that's either a nasal swab or a oral pharyngeal or a throat swab that's looking for components of the virus itself. So that's one type of test, and generally speaking, that test is very accurate. That is the test that tells you, do you have current evidence of the virus in your system?
Okay.
Which gives us a marker of are you infectious? The other test,
And you say that test is pretty solid. We can be
that test,
confident.
the one that we've been using at our Armory site, we generally have our test done through the public health lab, and that does take several days to turn around. That test is extremely reliable. There have been concerns with some of the rapid tests, and that's been sort of a work in progress as these tests come online. They're supposed to be vetted by FDA, and there's been some concern about some of the tests versus other tests. So, I mean, that's sort of an ongoing discussion, and so that data's coming in, and if that test becomes unreliable, then it will be discontinued. That's sort of how that process works. The test that, the data that we're getting is very good. So I'm confident that what we're doing for testing is well supported. The other test is the antibody test.
Yes, that's the other
And I think it's
question I
important.
had.
I think it's an important thing to talk about for a few reasons. The antibody test tells you, it's a blood test. I think it's generally a finger stick. It tells you if you've had an infection within the last 3 weeks or plus. So it measures antibodies, which is your body's mechanism to fight the virus, and it tells you you've had an infection at some point in the last few weeks or months, but you're generally not infectious to others, as so much as we can tell based on the types of antibodies we're looking at. So that doesn't tell you necessarily that when you were exactly sick. Some people were positive on the antibody test and didn't recall ever being sick. I liken it to back when West Nile virus first came into the country. I might have talked about this before. They did a blood test after that it all happened, and they found a bunch of people, a very significant amount of people that showed evidence of infection, but never reported any symptoms. So there are a good chunk of people who are asymptomatic, meaning without symptoms, and also still infected and infectious at some point. Now, we're still going to call those people and talk about, did you have symptoms? Because we want to know that. And we also want to know if they had any contacts that we might want to follow up with. But what I want to emphasize is it doesn't mean that if you have antibodies that you are immune to getting COVID-19 or COVID-20 or whatever. God forbid we have another iteration of the virus. We don't know, I shouldn't say it doesn't, we don't know at this point in time if having those antibodies is going to protect you against a similar or the same infection at some later date. Which is
And I'm
which
sure,
is hard
sure if
for
we don't know
people-
that, we certainly don't know how long the immunity might be for
Correct.
these antibodies, right?
Correct.
We can be very hopeful that that's the answer, but
And I know that there are several academic institutions that are now tracking people moving forward to try to answer that question: how long is that protection? And then whether it's animal study. I know there's a lot of vaccine development going on right now. That's another piece of the equation. Generally speaking, new vaccines take months and months, if not years, to develop. There has to be obviously safety. From what we're seeing about the virus, generally speaking, is for the people who are getting really ill, the clinical manifestations are sort of a hyperactivation of the immune system, causing kind of your body to go haywire. I guess it's not a medical term, but it really is an overacting immune system. So there are some people who think if you're trying to build a vaccine that is trying to prevent that from happening, or could you stimulate a response that may be pretty significant in terms of side effects. So these are all things that have to be studied and tested. There's so much research going on in this field. And the other question is it going to be effective, and for how long? So is it safe? Is it effective?
Yeah.
Do we need an annual version of this?
yeah.
These are all questions that have to be answered from testing
Yeah.
and study. And so that also makes this hard because you don't have an end date. Flu season is going to end. Mm-hmm. We don't know when COVID season is going to end. Hence the fact that we need to keep following up on cases. We need to keep testing. We need to keep social distancing to the best of our abilities and doing proper hand hygiene and etiquette, because what we do as a person could impact others. So I hope that other people are caring about their fellow citizens and their fellow citizens' loved ones enough to be smart about it.
Let me just remind everybody, our guest is Phil Alexakis, and he is the Chief of Operations and Deputy Health Officer for the City of Manchester. He was our guest back in March, and that was an outstanding show, and I think we're having another great show tonight. And I have to say, Phil, it's public health that keeps you from getting sick, right? The rest of the health system is helping you get better when you're sick.
That's
but
it.
if you want to stay healthy, these are the people like Phil and the others in this profession that they are the key people in this. And that is such an important thing to remember, because these are the people who are going to keep you from getting sick. So you should be very grateful for the work they do. And I'm learning that a lot of your work is not sitting behind a desk. You're out at schools and restaurants and everywhere all the time, huh?
Yeah, if we're not out doing that type of work in the field, or following up on potential cases, or tracking down situations that could result in outbreaks, that's our bread and butter is illness prevention. And then hopefully nobody hears about it, because we're doing things that are preventing illness, but everything is at the forefront now, because we're talking about we've investigated 900 cases, and each of those cases has contacts, and it's an unprecedented effort. I want to, our school nurses that work for the health department,
Yeah.
we have, they still are working with families, and they are still doing care plans, and they're doing food deliveries and things to take care of families. But they have also done an amazing job helping us with all of our case contacts and investigations.
Yeah.
So we've been very fortunate to have that surge. I want to thank all of my colleagues at the health department, because
Yeah, I'm sure they're all working incredible
they're
hours.
they're still at work, following up on cases. Our job, our job never ends. I shouldn't say just during COVID. Our job never is never a 9 to 5 job. It's a 24/7, 365. Somebody in public health is working every day of the week, every holidays, you name it.
And we should all be very grateful. I certainly am. We're practically out of time, and there's so much more we could go into. But
I'm welcome.
But
I'm happy to come back to.
well, we probably
update.
will take you up on that.
Sure.
But, just one other part of public health that we've danced around but haven't really talked about. There's all this requirement for us to protect ourselves by following the protocols for sanitation and all of that, and hand sanitizer and washing hands and distancing. But the other part is contact tracing.
Yeah.
Is that going on? Is that a big part of what you're doing
Absolutely.
now too?
So that's essentially what the nurses and our nursing staff. So we get some. I'll kind of explain how it works. We get a message in a computer system that says, this person needs to be followed up with because they are a case of X illness. It could be salmonella. It could be COVID. We have to initiate contact with that person and ask a litany of questions. If it's a foodborne illness, it's a series of food questions, travel history, a whole host of things. If it's COVID, we need to know, what do you do for an occupation? Do you work in an office? Then we will get a list of potential contacts. In the situation for COVID, we have to notify the employer, because we need to verify that person is not at work, for one, but also, what do they do? Who are the people that they work near? Because sometimes stories don't always align, and we have to get, anyone who has a potential exposure, we need to interview. And then we have to explain what quarantine is, meaning you have to be home, monitor symptoms, and that's the contact tracing. We need to know the case and anybody that the case may have exposed, because we've been able to, in New Hampshire, and I'll say this, unlike other states, we've been able to keep up with the caseload and the contacts to keep things from bubbling up to, there are so many cases that it's a moot point. We just can't get our arms around it.
Yeah.
We're still there, but
Bet you could use a lot more people, though.
we do. Yeah, that was what we were talking about with the state, is exactly that.
Yeah, I'm sure. Well, we're out of time, Phil, but thank you so much for coming in.
my
I think
pleasure.
This has been a terrific help to people, and I really, really appreciate your being here and what you do.
Thank you.
So
we,
thank
we,
you.
we all appreciate it.
I suspect we'll have you back.
Sure.
We can talk about whether what's the chance
We'll
we'll
talk
be
about
back to school and
anything.
everything
Yeah,
like
well,
that.
that's we're going to have a meeting on Friday about that.
Okay. Take care, folks.
Thank you. Be well.